Hello everyone, I am Dr. Prateek. Today I am going to show a surgical video of arthroscopic meniscus repair surgery. So our patient is a middle-aged woman who twisted her right knee joint a couple of months back, and after that she continued to have pain in her knee joint, especially while bending the knee. So we clinically assessed her and we got the MRI done, and it showed medial meniscus complex tear involving body and the posterior horn. So what is this structure known as meniscus? So I have a knee model over here, and as you can see, this is the front portion and this is the back portion of the knee. This is femur bone, this is tibia bone, and this is fibula, and this is the knee joint. So the structure that you can clearly see between the femur and tibia bone, this blue structure, this is known as meniscus. So this structure provides concavity to our knee joint, and it also provides stability to some extent. So what happens is, when there is twisting injury to the knee joint, the femur rotates over tibia and it leads to shearing forces which can tear the meniscus or even tear the ligament which are inside the knee joint, such as ACL ligament over here. The etiology of the meniscus tear can be grossly divided into two categories. The first category is traumatic. So this kind of meniscus tear are usually seen in young individuals after road traffic accidents or due to sports related injuries. So this kind of meniscus tear should be ideally repaired because they are in the young individuals, and if we do partial meniscectomy in young individuals, it will eventually lead to early osteoarthritis. Now coming to the other category of the meniscus tear, that is degenerative meniscus tear. So this kind of tears are seen in elderly population, and this is part of a degenerative process. So this kind of tears can be treated with partial meniscectomy, and if the health of meniscus is good, then they also can be repaired, provided mechanical malalignment also have been addressed in such individuals, because we usually see varus deformities in the knee associated with medial meniscus tears or root tears. So we need to address both mechanical deformities as well as the meniscus tear. So let's start with the surgical video of arthroscopic meniscus repair. So these are the T2 sagittal MRI cuts of the right knee joint, and as you can clearly see that there is tear involving posterior horn of the medial meniscus, and it is extending to the body. So now let's start with the arthroscopic meniscus repair procedure. On diagnostic arthroscopy, we can make out that there is longitudinal tear involving the posterior horn of the medial meniscus under surface, and this tear is extending to the body and exiting centrally as a radial tear. So since it's a combination of longitudinal tear with radial tear, we call it as a complex tear. So now before we start the meniscus repair procedure, we are going to do MCL pie crusting to have better access of the posterior horn of the medial meniscus. And now we have inserted the all inside device, and we are going to take our first bite through the posterior part of the medial meniscus. This is going to be a vertical mattress configuration suture repair. After deploying the first implant, we are going to gently withdraw our all inside device. So now we are going to pierce the needle second time to deploy the second implant. So we have deployed the second implant, and now we are going to withdraw the all inside device, and now we are going to gently pull the thread, and this is going to reduce the longitudinal tear. So Now we are going to push the knot and cut the knot flush. We are going to follow the same steps to take another vertical mattress knot. Now for the radial tear in the body, we are going to use outside-in technique to pass the suture in horizontal mattress configuration. So as you can see that we have passed the fiber wire in horizontal mattress configuration by using the outside-in technique, and this is the picture of meniscus after tying the knot as seen from the anteromedial portal. And this is how the repair looks from the anterolateral portal. As you can see, there are two vertical mattress all inside sutures and one horizontal mattress suture taken by outside in technique. This completes the procedure. Thanks for watching this video. Do like and share the video and subscribe to the channel.